Hi, I'm Chuck Furlot, and welcome to Heart, a podcast series on leadership brought to you from the Welsh College of Business and Technology at beautiful Sacred Heart University.
Chuck Furlot is a successful business executive, a guy who's worked very hard to get to where he is, emphasizes learning, taking care of people, and always meeting his responsibilities. He's actually a great role model for someone who wants to grow in their career. Has always wanted to do more, grow more, and make a greater contribution. And he's never ending. And you're gonna have to nail his coffin shut when he dies, because he's gonna want to do one more deal, for sure.
Greetings, this is Chuck Furlot, and welcome to Heart, a not too subtle play on the name of the school from Sacred Heart University. And I'm delighted today to have as my guest Jeff Flaks, Chief Executive Officer of Hartford HealthCare, a fairly significant, some would say massive healthcare system in Connecticut. Jeff, thank you for your time, kind sir. This is all about leadership, and that's why I'm coming to you. Greetings.
Oh, thank you so much. Pleasure to be here.
Tell me a little bit about your journey, Jeff, before we get into the real heart of leadership, where you grew up, your folks, where they are, if they are still.
Yeah, thank you. I didn't grow up far from Sacred Heart, by the way. So I grew up in Orange, in Connecticut, not far from Sacred Heart. Both my mom and dad were public school teachers. My father taught in the city of Milford for 43 years.
Wow.
My mother taught for 35 years in the town of Orange. So, I had a wonderful upbringing, went to public schools in Orange, ultimately in Amity High School. And, Chuck ended up having a very unique experience because when I had the opportunity to work for a local pharmacy and served for several years as a delivery boy, and that exposed me to healthcare. And I had an opportunity to see all facets of healthcare, and gave me a sense that that would be the right place for me to make my life's work. And I ended up going away from formal sense of education, which was the family business, so to speak, and went into healthcare. And it's been an incredible journey for me.
That's incredible. I was recently reading Jeff Imelt's book on Hot Seat, his story at General Electric, and he made the comment that if he hadn't have learned how to fix an appliance, because they had a massive recall on thousands of appliances at General Electric. I forget if it was washers or dryers or what it was, but he said if he hadn't learned to fix that, he probably wouldn't have accomplished being CEO, hanging out in the corner office. So you're saying that your work as a delivery boy probably has some role to play in in your arrival.
And Chuck, it's really surreal because when I worked at the pharmacy, first of all, it was, I always describe it as it was last century. So it was in the late 1980s, early 1990s. And in doing it, we didn't have cell phones. We didn't have navigation systems. We didn't have power locks and steering on my car, by the way. I mean, it was a different time period.
Right.
But I had the privilege of, I would go to nursing homes, to health centers, physician offices, and occasionally hospitals. And the one hospital that was on my route in particular was St. Vincent's. And many years later, we brought St. Vincent's into Hartford HealthCare. And when I first went on site, and we were looking at the facility, and I was talking to the staff there, people said, "Have you ever been here before?" And I said, hundreds of times, because I had delivered medication.
True story.
Yeah, many times.
True story. Are your parents still with you?
They are. Yes, thank God they are. So my dad's just about celebrating his 85th birthday, and my mom's just a few years behind him.
And do you have a true appreciation of what you've accomplished?
Yeah, I have to tell you, I have such respect for what they did, and what they do. Last night, I was at an event at the Hartford HealthCare Amphitheater, And two people approached me who were part of M&T Bank and indicated that my father was their teacher. And they said that, he's obviously been retired for several years at this point, and they described the impact he had on their lives. And they were about my age.
That's beautiful.
So it just reminded me, about the importance of education, the importance that teachers, educators have on people's lives. And it was really rewarding to hear that, to see that.
Tell me a little bit about Hartford HealthCare. 45,000 employees, 7 hospitals?
Yeah, so I've been here 21 years. And Chuck, I consider it the blessing of a lifetime. This is the most amazing organization. We have the most incredible people. What they do, the people who work within Hartford HealthCare, my colleagues, the miracles they perform, the empathy that they demonstrate, helping people in their moments of greatest vulnerability. It's really just absolutely incredible to see. So, we become, when I joined Hartford HealthCare, we were 2 hospitals. We were basically a holding company, and we operated we had about 7,000 people who worked within Hartford HealthCare, but it was really 2 distinct institutions with one parent organization. And if you fast forward 21 years, we have 540 locations. Less than half of Hartford HealthCare are really hospital-related services and people. The vast majority of what we do are in the community, closer to people's homes, delivering services through physician offices, through virtual programs and services, through home care services, through community-based health centers and programs. So I've had the chance over 21 years to see the complete kind of evolution and transformation of healthcare from being very hospital-centric to now being a system of care and really becoming an organization that can meet people where they are. So it's been an incredible thing to participate in and be part of.
You have a kiosk at the Hartford, at Bradley Airport. That's wonderful.
We do.
Tell me a little bit about that, the idea behind it.
Yeah, Chuck, I describe this as the greatest time to ever work in healthcare. Yeah. There's never been a time where we can do more, be more creative, reach people differently, ensure that nobody's left behind. And there's more ways to deliver healthcare more accessibly, more affordably, more equitably. So this notion of what we created at Bradley Airport is a perfect example. There's 12,000 plus people who travel through Bradley Airport every day. There's a significant number of people who work at Bradley Airport. So in talking to the airport, and by the way, it's a great airport. It's a beautiful entryway into the state of Connecticut, and I have tremendous pride in Bradley and what it does. They said to us, we would love to have a healthcare program available to people when they need it. So by creating the program, this kiosk, we're there 24 hours a day, 7 days a week. So at any moment in time, when somebody needs a consultation, when they need to see a provider, they go into our kiosk. There's a significant digital screen around the entire circumference of the kiosk, and apparatuses come from the ceiling, from the walls, and the provider comes on the screen and can deliver an entire exam that the patient self-administers and can provide ultimately a diagnosis. And if they need a prescription, they can deliver an immediate prescription. To provide immediate care to people in the airport when they need it. So it's very helpful. And it's just one of, I describe healthcare, we need to be a house with 1,000 doors.
Yes.
We have to figure out ways to be where people, so we're in Walgreens, we're in Stop and Shop, we're in the Amazon One medical centers. And more importantly, Chuck, we're in the palm of your hand. We launched an app called Hartford HealthCare 24/7. So anyone at any moment in time on their phone through this app that you can download through Apple or wherever else, and you can plug into your provider on our electronic health record with our credentialed providers, and they help people. They avoid emergency department visits. They avoid more expensive levels of care. They provide, we're now going to do behavioral health and weight loss management and other types of services, digestive health services through this type of program. So I'm so excited about what's happening right now, and the opportunities are endless today.
I served on the board of St. Vincent's for a number of years, in the days of Susan Davis, great lady, great leader. So I know enough to be dangerous. Tell me, I've always felt that to lead a hospital system, there's what I call a schizophrenic pull between quality and safety on one end, and then on the other end of the continuum is the necessity to know every nickel of your cost. Tell me a little bit about that and how you deal with that.
Yeah, that's a wonderful question. First of all, what an honor it is to be able to be a leader in a healthcare system. I mean, what we do has so much purpose. It has so much meaning, right? It's essential. And when people need it, we're here, whether it's our helicopters, our emergency departments, our cancer institutes. So the opportunity to ensure the sustainability of an organization like ours, to ensure that we're continuing to innovate, advance, invest, it's the honor of a lifetime. To be a person from Connecticut, to be in this situation where I can be part of this organization in this capacity is an amazing, amazing experience. And I feel so blessed. The challenges in healthcare are significant. So healthcare needs to change. It needs to become something different. It needs to become more accessible. It needs to become more affordable. It needs to become more equitable. People's zip codes can't determine their life expectancy. And it needs to become better from a quality standpoint. I mean, the types of things that still occur that we want to be never events, but still happen within healthcare systems today, we need to get better. So, this is a balance, as you point out, around ensuring that we are financially stable. We're able to meet our obligations, invest in our technologies, our services, invest and retain in our people, and at the same time, maintain an absolute vigilance, primary focus on quality, safety, and the essence of why we're here, or the services we provide. So it is a natural tension that exists, but from my point of view, this work is about always the golden rule. Right, ensuring that we care for every person, like they are our own, and trying to do it the very safest and best way we can do it every single day. And Chuck, we care for 27,000 human beings every day at Hartford HealthCare. So I always describe that. That's 27,000 people's mothers, fathers, brothers, uncles, best friends, our teachers, our police, our fire. That's who we care for. And that's why we're here.
Yes. Jeff, tell me a little bit about culture. If we read, the Harvard Business Review, it'll tell us that 80 to 90% of failures of acquisitions have to do with a cultural misfit, if you will. And so with your growth, with your tremendous meteoric growth over the last few years, how do you look for that? How do you ensure that there's a sort of a cultural continuation? That how do you take something and blend it in with what you already have?
Culture is everything.
Yes.
And culture is the most important thing. We've been very, very fortunate. And Connecticut has, by the way, world-class healthcare. We are at the top rankings as a state in nearly every indicator across the country. And based on every organization who evaluates the 50 states, Connecticut is a top 2, 3, 5 performer on all of these different indices. And, I talk to the governor all the time, and I said, listen, I'm from the New Haven area. Nothing's more important than New Haven pizza. I grew up as a massive UConn basketball fan. My dad was a high school basketball coach in Connecticut.
And you played, right?
I did, and I celebrate basketball in Connecticut, and it's a passion of mine. But I said, truthfully, amongst all the things we celebrate, we should be celebrating healthcare because we are very fortunate to have incredible healthcare. The way we create incredible healthcare, it's through our people, which is our culture. Yeah. And so when we talk about culture, to your question, I describe sometimes there are places across the country who have greater pedigree than Hartford HealthCare. They may be more famous, more well-known for whatever reason. There are places that have more wealth or bigger balance sheets for different reasons around the country. There are places who have, in some instances, more favorable demographics that allow them to have certain types of advantages. There's nobody who has better people, and there's nobody who has better culture. Mm-hmm. And that's why we in Connecticut perform at the level that we do. We have an amazing culture. So anytime Hartford HealthCare expands or grows, the first and primary focus is around strategic alignment. Do we have cultural alignment? Do we have a shared point of view on our core values, a shared point of view on our belief in the future of healthcare, and a shared commitment to our community? And anytime that we've chosen to move forward, if those things aren't met, we don't move forward because the culture of this organization is what allows us to be who we are.
Let me unpack that just for a second. I spoke about what I thought was a schizophrenic pull between like quality and safety and cost control, which are all necessary, right? They're all necessary ingredients. The other schizophrenic pull that I would suggest is the massive bandwidth in profession that you have in careers, because you have everything from the floor sweeper to the literally and figuratively the brain surgeon. And so how do you deal with all that? You're not just dealing with, it's not Price Waterhouse with a group of accountants.
Right. First of all, healthcare is the ultimate team sport.
Yes.
I mean, we celebrate all the time the heart transplants we do, the liver transplants we do. We celebrate the missions that LifeStar flies. And what everyone has to appreciate, it takes 45,000 people to do that. It takes every person in this organization who has a specific role, a specific contribution to those miracles happening. And every role is essential. So that is one of the beautiful things about healthcare. The diversity of people in roles within healthcare is amazing. I mean, we have 1,000 people who work in our IT division. And the IT division in Hartford HealthCare is absolutely crucial to our ability to do what we do. And their technical expertise is unmatched. We have a biomedical division, right, that maintains tens of thousands of hundreds of thousands pieces of equipment that have to be meticulously maintained with precision. That their expertise is so crucial, so expert. Right? The people who oversee our helicopters, right, have to be perfect in terms of the mechanical aspects of that. So whatever segment of Hartford HealthCare, whatever role I could speak to within this organization, from our fire safety team to our public safety team to our environmental services, food services team, they're all critical. That's why I call it the ultimate team sport. And it's what makes work in healthcare so special, because really every role is dependent upon the other role. I mean, if central sterile supply doesn't work to perfection, then you could have the most outstanding neurosurgeon in the organization, and they will not have good results because there will be infection and there will be complications. So every person in this organization's role matters to that end result. And our job is to always ensure that everyone understands that purpose, and that's culture.
Do you observe heightened levels of stress and anxiety amongst your professional staff? Because to a certain extent, they're the ham and the sandwich, if you will, between insurance on one hand and the patient on the other. Is that an issue?
It is. Look, in almost all professions, with first responders and setting aside a few others, most people don't encounter the types of things that our colleagues do on a daily basis. Right? For those people who work in the Cancer Institute, what they do, the families they care for, the people who work in our birthing centers every single day. I mean, the people who work in so many segments of this organization, the trauma centers in particular. I mean, I could name so many segments of the organization, the types of things they're seeing, the intensity, the meaningfulness, the range of emotion. that's what they do for a living, and that's what they do each day. But when they go home to their families, when they go home to their personal lives, how one is able to kind of separate those two things, it's difficult. And the work we do, I mean, is so both important and intense that we have, as an organization, have to always be working to support our people through wellness, through health, create places for people to be heard and to be supported when that happens. But both here in Connecticut, across the country, the notion of burnout in healthcare is a very real issue. Our work can be so challenging, but I would point out it's also probably the most rewarding, right, at the same time. So it gets back to that dynamic tension. But we have to support people. We have to do more and more to help them.
Are there suicide issues with medical practitioners across the country? Doctors?
There has been. Yeah. There has been. There continues to be. I mean, you can appreciate working in behavioral health. Yeah. Imagine how hard it is to work in behavioral health. You're caring for people who are in such great need, who have behavioral health challenges. And it's personal for the people who work in healthcare. Chuck, people who work in healthcare, I often say it's a calling.
Yes.
They were called to do this work. Many of them are born to do this work, particularly our clinicians, our providers. So it's hard to separate these issues, right? To not take it home with you. And there are examples both here and across the country where suicide and suicide ideation is a very real issue. So we have to really listen carefully. We have to have early detection systems. We have to have mechanisms where people can raise their hand for help, and when they see that as strength and not weakness. And we have to have mechanisms where our teammates, our colleagues, are there to help people when they're susceptible and are at risk. So that's a very important issue you're raising.
Tell me a little bit about your leadership style, Jeff.
My leadership style, look, values-based and authenticity. I always say I am who I am. I like to quote John Wooden, the famous basketball coach from the 1970s UCLA. He always said, "You don't have to remember the story when you just tell the truth." And
he's also the coach, wasn't he? He's also the coach who had a specific instruction class on how to lace your sneakers, I believe.
Before the first practice, and how to properly fold their socks.
Correct.
And I often talk about that as well, because that's the attention to detail.
Yep.
And building the foundation right around health, wellness, and kind of setting expectations right around excellence. But my leadership style is about being transparent, about being engaged, about being physically present.
Yes.
And about having clear principles and advocating for, our people, for what we believe in, and trying to do my best. Say, while I'm in this role and I'm in this organization, I don't want to waste a single day. I want to do everything I can to make healthcare better, to make the state better, to make the lives of the people who work here better, and to provide as much support as we can.
And when you find a leader or any employee who's not doing the values, what do you do?
It needs to be addressed. Right. It does. First of all, it's the right thing to do for other people in the organization. I come back to culture and about having people who are aligned, who believe in the purpose, who are committed to our core values.
Yep.
When people are in conflict with that, they'll never be happy here. They'll never be fully successful here. It's not the right environment for them. So we really work hard to ensure we get the right people on the bus. Mm-hmm. Then we have to work hard to keep them on the bus. Yes. and re-recruit them and re-engage people every day, and reward and recognize and celebrate the people who are part of this organization. And for that very small segment of people who would be part of this organization and don't have a perfect fit, let's try to help them get to a place where they have a better fit. Treat them right, treat them respectfully, but you need people who are really aligned and committed and who are contributing that discretionary effort.
What would you say to your patients today, or would-be patients today?
So we have something, a mantra in Hartford HealthCare, in that we actually trademarked it, I believe, at this point. which is called the best at getting better. And when you talk to our colleagues, they're constantly talking about what it is to be the best at getting better. And what that means, Chuck, is we want to be obsessed with improvement. We want to be better tomorrow than we are today. We want to be better next year than we are now. And regardless of what our starting point is. So it's not about being the best, because the best, what does that mean? And it's a point in time. It's really about an obsession around getting better. So our obligation and our ambition in this organization, and what I would say to our patients, our community, we're striving here every day to get better, to be better, to improve. And we're constantly reassessing, looking at our data, looking at our performance, looking at the feedback we receive through many different channels, and looking at it with objectivity, with an interest and a passion around how do we improve and get better. And we're working at it constantly.
And how about your employees? What message would you give today?
Gratitude. Yeah. I would start with gratitude. I see it every day. I encounter people every day. I'm in different campuses and facilities constantly. I encounter people in the public constantly who are colleagues of Hartford HealthCare. The work they do is amazing. The contributions they make to our community as a whole is incredible. And I would encourage people to lean in and to keep growing. We're trying to create an organization. We have enough scale and enough resources and capability, Chuck, that we work to advance every person in the organization. We want to change people's lives. So we want to change generationally families' experiences. And to do that, we invest in our people, we create opportunity, we invest in their education, their training, we invest in them advancing both kind of longitudinally or laterally into different places. So I really just constantly tell our people who work within Hartford HealthCare, keep seeking opportunity, volunteer, put yourself forward, and the organization's going to meet you, more than halfway.
So how do you learn and grow, Jeff?
So I'm a pretty voracious seeker of content. So reading, I think I read 8 newspapers a day at this point. I look at content across various forms of social media constantly. I look to talk to, whenever I can, leaders who I can learn from, both people who are senior to me or retired, or people who are currently leading, from different fields, as well as my own field, and my own peers. So, I will work to try to remain, again, constantly inspired and motivated to improve. So from my point of view, that's part of being the best at getting better, which is seeking feedback in new ways to continue to learn. And much of it to me is from reading, looking and trying to study other people's best practices, but also analyzing with self-reflection, our own performance, my own experiences, and trying to really be in touch with that, so how I can get better and grow.
So where, in your opinion, a couple of last questions, where, in your opinion, do we need to go with healthcare? I mean, that's a massive question, I appreciate, but...
Like I said earlier, this is the best moment in healthcare ever. And the reason I say that, because many people look today at Medicaid cuts, they look at federal research cuts, and there's a lot of evidence to suggest this is a very difficult moment in healthcare.
Yes.
And that is true. And those are obstacles that we have to overcome, and we're going to have to work through, and there's turbulence right now. The reason at a higher level, I believe this is the best moment in healthcare, artificial intelligence and machine-based learning is an absolute game changer. Mm-hmm. As is the scientific breakthroughs, the types of things we're doing with personalized medicine, the types of things that we're able to do, today with drug development, that is personalized. It's incredible. So I think that the rapidity of improvement today, particularly because of AI, it's an incredible moment for us. And we're scratching the surface. I mean, in healthcare, AIs will be ubiquitous. It's going to touch everything we do. But we're seeing real life examples now of it making healthcare safer, making it better, making it more efficient, and absolutely making people better faster. as a result. So I think healthcare is going to get significantly better at a global level. We have to change kind of payment systems around healthcare. We have to change certain aspects of how insurance works and how insurance is covered. I mean, there's many systemic and structural things that need to change. But while those things have to happen and will happen as time moves forward, we shouldn't lose sight, of the improvements. Morbidity, mortality is better than ever. Survivability is better than ever. The cures we're creating around cancer are faster and better than ever. The ability to care for people with chronic disease, it's the best it's ever been. So, I'm an optimist, and I see these extraordinary improvements happening. And at the same time, I recognize the significant challenges, and those are just challenges we're going to have to address, and we will.
Jeff, given that we're in a learning environment here at Sacred Heart University, the majority of the population here is between 18 and 24. What message would you have for them today as they embark upon life?
Yes, so I think there's great opportunities. As I described, if I was in that position today, I would be working on a lot with artificial intelligence. Mm-hmm. I would be working a lot with data and the opportunities, and how we can use data to inform our decisions. We have better data today and more access to big data that can be more informative than ever before. And I would encourage, people to embrace and follow their passions, to seek and develop expertise. And I tell we have many early careerists here who work within Hartford HealthCare that we have as cohorts that I work with. And I tell them, I said, look, you don't have all the answers. No one would expect you to at this point in time. And it's not a straight line. So you're moving forward and you're learning, and sometimes you're learning maybe, what you don't want to do. You're learning and pivoting at different points in time. Stay true to your core values, but consistently volunteer, consistently embrace everything that's asked upon you as an opportunity, and lean in. And even the bad experiences are good experiences, and the good experiences are good experiences, because all experience is part of your personal growth and development, which is going to help you be more impactful as time goes forward, and be more specific about the areas that you think you can make the biggest impact. So I think it's an exciting time for people coming out of Sacred Heart, which, by the way, President John Patillo, awesome leader, one of the leaders I seek counsel from.
Yes.
An entrepreneur, an innovator, someone who challenges the status quo.
And you have a unique partnership with Sacred Heart.
We do. And I can tell you, President Patillo has lunch with the students, teaches classes, walks the dormitories. He's an example for me of somebody, despite the very significant change agent that he is, he has such an incredible balance of staying close to his people, close to his customer, so to speak. And he's so in touch, such an advocate for his students. I mean, just as an aside, when a student from Sacred Heart ends up in our hospital, because we help and support Sacred Heart, he personally comes and sees them. He calls their family. He goes to if they get injured or hurt, he goes to where it occurred and meets with the other people who are impacted by it. He's the type of leader I aspire to be. And he's one of those examples of somebody, who I've learned a lot from, may help make me better. And he's a community person. I mean, he just has contributed a lot to Fairfield County, to Connecticut as a whole. So Sacred Heart's blessed to have him.
Wonderful example of servant leadership, to use that term. Jeff, as we say to our military women and men, thank you for your service. This has been absolutely delightful. This is Chuck Ferlot at Sacred Heart University with the Heart to Heart podcast, and my delightful guest today was Jeffrey Flaks, Chief Executive Officer of Hartford HealthCare. Thanks for joining us. Stay tuned for more conversations on the Heart to Heart podcasts on leadership.